Yes.
Good afternoon. Welcome to the third installment of the Guidance for Parks as an Essential Service During a Pandemic lecture series. Today's lecture is titled The Role of Parks in Addressing Toxic Stress and Inequity. My name is Dr. Razani. I direct the Center for Nature and Health in the Department of Epidemiology and Biostatistics at UCSF. Welcome to our live audience, which includes colleagues at park districts around the Bay Area, land managers, nonprofits working in the outdoors, and people from out of state. We are thrilled that you can join us today. Thank you to our partnering agencies, which include the Department of Epi and Bio, the Association of Bay Area Health Officers, East Bay Regional Park Districts, SF Park and Rec, Marin County Park and Rec, Santa Clara Park and Rec, San Mateo Parks, Sonoma County Regional Parks, Together Bay Area, and Bay Area Regional Health Inequities Initiative, and others for helping to put this lecture series together. A few ground rules for our audience as you watch. If you click to fit your Zoom into the full screen, you will see the slides a lot better. We have been soliciting questions by email and we'll be answering those. And in addition, we'll be responding to questions entered in the Q&A function. We will not be using the chat function for questions. None of the speakers have a conflict of interest to announce, and we will post this video along with past videos on the School of Medicine YouTube channel afterwards. Today's lecture will start with 4 lectures. The first is by Katie Albright, who will give us an update of the signs of toxic stress that we're seeing in our society currently. That will take us until about 2:20, when I will come back to do a brief review of the science that talks about the ways in which parks may help address this increase in toxic stress. At 2:30, Melissa Jones of Bay Area Health Inequities Initiative will discuss park access and what that means for health equity. And then at 2:45, Annie Burke of Together Bay Area will help us envision and review strategies to accommodate park users while flattening the curve. Then at 3 o'clock, we'll be joined by Dr. Radhakrishna, who is co-chair of the Health Equity Committee of California's health officers for a Q&A session, which will feature all of the speakers. As you know, this lecture series has been the beginning of a dialogue and what we hope is a source of empowerment to give you access to the most up-to-date information. These lectures are not meant in any way to replace local policy or to approximate the very hard decisions you're making, but just to give you as up-to-date information as you can have while you're making those decisions. And with that, let's move on to our first speaker. Katie Albright is CEO of Safe and Sound. She joined Safe and Sound in 2007 when it was named San Francisco Child Abuse Prevention Center. Her prior experiences include SF Deputy City Attorney, representing SF City and public schools. And Katie will give us an update about toxic stress and the ways in which the pandemic may be placing pressure on children and families. Katie Albright, it is such an honor and pleasure to have you here. Thank you for joining us.
Dr. Razani, thank you so much. Really very appreciative of shining the light on this very, very important issue. I have several slides I'm going to share, so I'm just going to share my screen with everybody. Terrific. So I first wanted to talk a little bit about the work of Safe and Sound. As you said, we're a community-based organization in San Francisco. We've been doing our work in the community for more than 45 years. We started with an amazing pediatrician who was in our community, an epidemiologist, Dr. Moses Grossman, who saw what was happening in our community in the late 70s and said, how as a community can we come together and protect children and strengthen families? And the first thing that he created was a public-private partnership to really think about, as a collective, what are all the components that the community can bear to ensure that kids are strong and safe. Now we continue to do our work that Dr. Grossman founded during that time with an ever vision of ending child abuse in our community. We do our work in 3 ways. We partner with families to provide one-on-one services, crisis services, which are ever more needed now in COVID-19 and shelter in place. We also provide significant community education, raising awareness about how to identify and how to report child abuse. And finally, we partner with others, particularly our government partners, our philanthropic, our business partners, to ensure that we have a community where all kids are safe, and how can we change systems and change structures to give the benefits to kids and families. I wanted to today, and I've been asked to speak about trauma and toxic stress, to talk about what the impact is of COVID-19 and shelter in place on children and families, as well, and importantly, to talk about community protective factors, more specifically parks, and how parks play a key protective factor in keeping children and families safe. Let me, before I talk, let me really share about Safe and Sound's approach, because I think it's critical that we put children at the center of our work. We want to ensure that all children are safe and happy. And in order to do that, we must ensure that there are protective factors, families that are strong to protect children. And in order to create strong and healthy families, we need to create an engaged community that takes action to protect children. And in order to have a strong and healthy community, we really need an interconnected city that has efficient and effective systems. And ultimately, we need a society that does not tolerate abuse, and a lot of work around changing norms and beliefs in that. Let me turn to the issue of trauma more specifically, because during shelter in place, that concept of a healthy and happy child has been disrupted quite severely. And now we are in a time where families are navigating a new public health and safety protocols. There's been school closures, there's uncertain childcare arrangements, job loss, social isolations, and significant barriers to critical support services. All are creating impacts and significant trauma on families. Trauma that was already there, that's now exacerbated even more. And again, I think the parks have a very important role to play in all this. So in terms of talking about toxic stress, I want to talk more specifically about a seminal study that was began in the 1990s to really focus on adverse childhood experiences. You may have heard of this work in readings. It's known as ACEs, Adverse Childhood Experiences, and it started with a study in the 1990s, late 1990s, by Dr. Vincent Folletti of Kaiser Permanente, who was working in partnership with Dr. Richard Anda from the Center of Disease Control. And what Dr. Folletti was finding was that many of his patients who were living at that time in San Diego, they wanted to lose weight. But he noticed that for a period of time, they would lose weight and then they would gain it back. And he wanted to understand why this was happening. And he partnered with the CDC in order to take a more close look on what was actually going on. And what they found after looking at a significant population, 17,000 members in the San Diego community, mostly middle class, mostly white. And what they found was, asking a series of questions, that many of them, and I'll share the data with you, had a significant impact of abuse, neglect, and household dysfunction. All of these creating toxic stress and impacting not just that immediate time as a child, but long-term health impacts as they were growing older. And what the researchers did was they defined adverse childhood experiences to be one of these 10 factors. And you can see on the slide, there's 3 factors for abuse, 2 factors for neglect, and 5 factors for household dysfunction. And every one of these factors was given a score of 1 in terms of asking the question for the adults. Again, these were 17,000 adults that were living in San Diego that were primarily middle-class white members of the community. And what they found after doing their research was that only 33% of the community had no adverse childhood experiences scores, and 66% had 1 or more scores, with a significant percentage having 4 or more. And what they further found was that if you had one of these ACE scores, you were more likely to suffer from serious long-term physical and mental health issues, as this slide shows, which is significant when you think about what are the long-term health impacts to our communities and what are the long-term social impacts to our communities. And the job that we have now is, how do you reduce adverse childhood experiences? And how do you think about reducing that toxic stress? Because what happens is, when you're experiencing adverse childhood experiences, through an interplay of very significant brain science, immunology, genetics, and epigenetics, you're changing the structure of the brain, and all of a sudden, over a long period of time, a buildup of stress and fear and uncertainty, you are having these long-term health impacts. In fact, what it's been shown now after years of research is that the top 10 most common deaths in America all have their roots on this early trauma. It's one of the main charges that Dr. Nadine Burke Harris, our California Surgeon General, is really taking on, is how do you think about raising awareness about adverse childhood experiences, and what are the disruptors that we can think about as a community to ensure that we're preventing these experiences from happening. And what the research has continued to show is, it's not just about these experiences that are happening in the home that creates a toxic environment, but it's the experiences that are happening in our community as a whole. And you can see that the experiences are really the root cause of so many of the social ills that we as communities are trying to prevent, from poverty to violence to poor housing inequality, homelessness, discrimination, community disruption, and lack of economic opportunities. And I want to stop there, because COVID-19 and shelter in place has created a huge adverse community experience for us. And it has exacerbated every aspect of the factors that are on this slide, in addition to being its own adverse experience. And so you can imagine what we're all coping with in terms of stress and anxiety at home, what the impact is of children, what the impact is on family unity, and how this impact will carry on for our lifetimes. And I want to end, and I will, on a hopeful note, in such that there are opportunities to disrupt this cycle and to ensure that there is healing and wellness. But let me go into a little more on the statistics around what's happening in terms of COVID-19 with children and families. What experts believe around the country is that families are in extreme circumstances, and children and the safety of children at home is at risk, both with their mental and their physical well-being. Days after schools closed, child abuse reports in our country actually decreased. And that's because mandated reporters, like school teachers, were not involved in children's lives at that time. But it doesn't mean that children were safe. necessarily. And it doesn't mean that families didn't have all the protections that they need in order to keep their children safe. And that's what we're worried about right now. Because related to that decrease in reports, we also saw a significant increase, a doubling, and in other communities, far more, doubling of domestic violence calls. We saw a dramatic exponential increase in the number of calls to parental stress warm lines. In San Diego, we saw a 400% increase. In San Francisco, and we at Safe and Sound run a warm line, we have seen a 100% increase in our call volumes. We've also seen massive increases of food insecurity, and you can read this in the national as well as the local papers. At a community level, our resources are getting stressed, and certainly at a systems level, our resources are getting stressed. Overlaid on all of this, we are seeing significant impacts on inequities. COVID-19 is not causing these inequities, it's revealing these inequities, and we're seeing it with health and economic impacts, with xenophobia and racism, as well as the underlying structural inequities that are deepening in our communities and in our systems because of shelter in place and COVID-19. And I wanted to really end on components around, so what do we do about this? And there is hope. At the family level, at the individual level, we are very focused and have been on building protective factors. There are 5 protective factors that are on the slide: improving a child's social emotional competency, increasing parents' knowledge of parenting and child development, improving parent resiliency, family social connections and creating those social connections, and again, creating concrete supports in times of need. And you can understand that during this COVID-19 crisis, we are seeing each one of these protective factors for families and parents and caregivers being put at risk. And so it's our job as community providers to ensure that we are building these protective factors. We also, as a community, can think about building community protective factors, really focusing on increasing economic supports, creating safe and stable housing, and creating equitable access to parks, healthcare, social services, and community activities. We need to build up quality childcare and education, as well as continuing to focus on social norms. And with this, I want to underscore, and it's highlighted here, the importance of parks. Because with parks, we can build up community resiliency, we can build up, and we can just frankly take a deep breath. We can bring communities together at a social distance way. We can bring families together to be out of the home and just be together in a relaxed environment. Where families can take a break together and enjoy each other's time together, and again, lower that toxic stress. So I know I've said a lot in a short period of time, and if you have more questions, and I'll send this information out, or if you know community providers that need help, or parents and caregivers that need help, I urge you to call our 24/7 phone support line. It's 415-441-KIDS. We're servicing the entire Bay Area, and we're here to help. Thank you so much. I really appreciate it, having this opportunity. And back to you, Dr. Razani. Thank you.
Thank you so much, Katie Albright. Can you say that phone number one more time?
Absolutely. It's 415-441-KIDS.
Thank you. And I look forward to having you join us for the question and answer period. Thank you. And as you were speaking, I remember what I've learned in doing this series, that parks are not just spaces, but they are also people. And I know that just like healthcare providers, the people caring for nature are also experiencing all the same stressors that everyone else is experiencing. And so I hope it doesn't feel like all of society's problems are being dumped on the people that care for parks, because like the rest of us, you need support in order to help us enjoy nature. And I hope that we will discuss how to support you in the question and answer period as well. So with that, I'm going to now talk about why nature is not a should have, but a must-have at this point. I'm Nooshin Razani, and I direct the Center for Nature and Health, and I'm also an associate adjunct professor of epidemiology and biostatistics and pediatrics at UCSF. So when I talk about the role of parks in helping with stress, I actually mean the role of outside nature and parks. And that's kind of how they talk about it in the literature. They talk about all three of those components. And whether you are outside, you're in nature, and or you're in a park, any of those can give you access to physical activity, fresh air, feeling connected to others, and can buffer stress. And it turns out that all of those things are actually very important in mitigating the long-term impacts of what is toxic stress on our neuroendocrine and immune systems. While most of us have learned about the benefits of regular exercise that happens consistently over the week, there is a body of literature showing that the same exercise done outdoors and in a natural setting has an added benefit for negative emotions and reduces anger, fatigue, and sadness as compared to that same activity indoors. In terms of air quality and access to fresh air, there are large cross-sectional studies showing that people who are born and live around green space throughout their lifespan have better health outcomes. And that's thought to be caused partly by the improvement in air quality when you have access to nature. And the third pathway that I talked about was that being outdoors helps us feel connected. And so it turns out that relationships are protective. In fact, social integration has a dose-dependent protective effect on health. And in some studies, that effect is even stronger than alcohol, tobacco, physical activity. And I put up this picture of a pre-COVID-19 gathering that I had helped organize for my own community to show that we used to think about being outdoors and connected in community in kind of a big way. But there is no reason why we can't get that same feeling of connection just going outdoors with a few people or with our own families. And in fact, the literature on toxic stress in children shows that even one powerful and strong relationship can change the course of a child's life. And the caregiver and child relationship is a central intervention target for improving the outcome with ACEs. And what research shows is that the quality of human-to-human interaction in the outdoors improves. And that is an unbelievable resource for families, because as families have a chance to interact better in the outdoors, caregivers feel more resilient, and caregivers can help model for children how to modulate their own stress and teach a child to self-regulate, which can really set a course of a lifetime of healing. I mentioned that nature buffers stress. So part of that is because nature increases physical activity, it increases access to fresh air, and it also increases connection to others. But there's also some sort of nature benefit of its own for reducing stress. So some studies take urban people and they put them in forests and they measure markers of stress such as cortisol, pulse, and blood pressure, and show a decrease when you walk through the forest as compared to a city walk. And then there are other really large studies that look at entire censuses or entire populations of countries and show that things that we associate with stress, such as anxiety, hypertension, maternal hypertension, preterm labor, are all decreased when there is more green space. And in general, those who live in greener neighborhoods have reduced mortality. They live longer at every income level. There is work showing that green space, or living around green, is also associated with reduced health inequities. For example, in a look at the entire census of England, they showed that cardiovascular disease is always higher in the lowest income group, but it's less increased when you also are exposed to a lot of nature. So if you take those 4 things, physical activity, fresh air, connection to others, stress reduction, you have that throughout your lifetime, you end up seeing a whole array of health benefits from being in and around nature. And there are more than 400 studies at this point looking at this nature effect. A lot of people ask me, how much nature do you need and how often? In our work, we really recommend the idea of a daily dose because the effect of nature is mild and incremental. There was one study that talked about 120 minutes, and some people thought that that's the most that you need, but I would talk about that as the minimum that you need. And then I would also look at the CDC's recommendation on exercise and just move them outdoors. So unfortunately, disparities in access to nature mirror trends in health disparities. And this is a look at the entire population of the United States. And on this graph, the green color, for some reason, actually corresponds with white race. And if you look at neighborhoods where the percent of vegetation is higher than 75%, the overwhelming composition of those neighborhoods is white. And this graph is independent of income. And so while income is very important to nature access, so is race, and that effect is independent of income. Importantly, how safe people feel in the outdoors also mediates whether or not they go there. So access is a required but insufficient precursor to spending time in nature. You also need to feel safe and welcome there. Let's skip that one. We did a survey of low-income families and asked them about different social needs, and then asked them to prioritize those needs. And I'm not saying that nature is not important, but I am saying that when people were asked to prioritize which was important to them, they did prioritize nature lower than food and housing. And so my recommendation to those people who love nature and want to also see people engaged in nature during this time is to not forget to talk about the whole person when you talk to them about getting outdoors. Because right now people are hungry, they are experiencing trauma, and yes, they do need nature, but they also need you to see the whole picture. A quick note on what nature does not do. Nature does not eliminate inequity. Nature buffers the effect of inequity on health, but we still need to work on the core causes of inequity. Nature does not fight viruses as effectively as a vaccine, and nature is not a replacement for access to quality medical care and quality life-saving medications. I started this section by talking about the 3 ways we define nature. We look at nature as an outcome, which are being outside, actual nature, which is green space, blue space, yellow space, and then parks. And I think COVID-19 has given us a real opportunity to mix that all up and redefine how we get outside and who is allowed outside. And so with that, I know we've taken you through some pretty stark realizations of what's happening in society, as well as the potential role of nature. I'm going to move on and introduce our next speaker. We will now be joined by Melissa Jones, who is Executive Director of BARHII. With Melissa's leadership, BARHII works to create the conditions that increase quality of life and make life more fair for more people. Hi, Melissa, welcome. Her experience includes work in municipal government and nonprofits in the Bay Area's large and small cities. Melissa is an active member in Oakland and also serves on the Association of Bay Area Governments Regional Planning Committee, which advises on regional planning issues. BARHII recently wrote a statement explaining their concerns about how park access is actually a health equity issue. And I'm extremely grateful for her to tell us about it and for joining us today. Welcome, Melissa.
Thank you. And good afternoon, everyone. It's a pleasure to be here and a pleasure to be talking to people who care so much about both parks and equity. I am going to take you through a conversation that tells you a little bit about BARHII and about the work that we've been doing around equitable park access. BARHII is the coalition of the Bay Area's public health departments. We were founded to focus on the issues that impact health that are different than the issues we think of in terms of healthcare and what happens inside a doctor's office. Our work is focused on the living conditions that impact health. We were founded by 4 public health directors, including at the time the sitting public health director in the city of San Francisco, the sitting public health director in Alameda County, in Contra, Costa County, and a health officer, who were looking at data and differences by life expectancy, which vary somewhere between 10 and 17 years based on race and the combination of race and class across our counties. And really we're realizing that no one program is going to change that scale of difference in life expectancy. BARHII, like the World Health Organization, did some deep work in looking at the living conditions and social inequities that were really behind driving that change. And so BARHII became the place where public health departments across the Bay Area began to work on the health protective issues that could protect health for the most people, with a particular focus on the most vulnerable. BARHII has been since then very focused on the range of issues that have impacted us for COVID-19. We have membership from across the region that's met multiple times over the course of the last few months to focus on important issues that are impacting COVID-19 and health. Among them are issues of housing stability and economic opportunity. And then emerged was an issue around parks access. In the early phases of the shelter at home, there were some immediate shutdowns of parks that came to represent an equity access about access to places to be outside. And BARHII's position on health, we put together a piece on parks access to help raise for people the issues around equity that may just not have been in the forefront of people's minds around what the impacts might be, particularly for low-income communities in the Bay Area. Safe access to state, regional, and local public outdoor spaces are very important during our shelter-in-place order. Access to open space, as we've already talked about, has significant physical and mental health benefits, reducing anxiety and the risk of cardiovascular disease, and ensuring low-income and communities of color have access to open space is very important for public health, and there are ways to balance the social distance. In particular, for access to open space in low-income neighborhoods, it's important to note that historically low open space has not been equitably distributed across our region or across our neighborhoods, and that low-income neighborhoods with a critical number of people of color often have the least park access in the Bay Area. Closing parks to only local neighbors can result, therefore, in large inequities that have lasting impacts. It's important to consider that people's access to outdoor space, regular physical activity, and fresh air during the statewide shelter-in-place and social distancing order has continued for multiple weeks. And so this is important because so many of our families across the Bay Area are in crowded living conditions. And so while many of us may be in homes where we are sheltering in place, perhaps with a partner and with children, We may be in homes, there are many people who are not in homes where everyone has their own room, or even where most people have their own room. And in California in particular, we have some of the highest overcrowding in housing in the nation. We have approximately 8.3% of our households living in overcrowded homes, while the nationwide average is only 3.4%. When you disaggregate by race and class, those numbers become much higher. And for renters, it's 13.3%. And that number is quite a low estimation of what the overcrowding looks like as a result of the high housing costs in our area. This means that people really need to get outside and people really need to decompress. And so one of the things we heard immediately after the shelter in place ordinance, about a month or a week later, we hosted a meeting of mental health professionals and domestic violence advocates to hear what was happening in the region. And there had been significant upticks, like we heard earlier, in calls to helplines and hotlines related to domestic violence. There was significant moves and focus and people in shelters. And really, one of the things we know that people need in this moment of isolation is the ability to get outside and to be in a place where they're less isolated, where they have time to decompress, where people have the individual space that they need. And so the last thing to consider that has been an issue for a long time for us in public space across the Bay Area and is an issue right now for thinking about parks will be equitable enforcement of social distancing and other items. So we know, for example, on BARHII, that while Black riders are 12% of the overall ridership, they receive half of the quality of life citations. And so we need to have some particular care as we think about both holding safety in parks through social distance and masking, and the way that enforcement is applied. In order to address the inequities in enforcement, we really encourage the same kinds of informal bias training that have been happening in counties across the region that we support and many others support through Governing for Racial Equity and other initiatives that have begun to be run across the region. And so I'll end with some specific recommendations for parks. And I think we've seen a lot in the media about people being too close together in parks or on beaches. And so we just want to remind people that while some of us read the paper a lot, not everybody does. And so reminder signs with clear instructions on social distancing and parking lots, trailheads, and beach access is really helpful and important. And the definition of the elements of social distance, including masking and masking within 6 feet, that level of detail is very helpful to people who are following, who are not following day-to-day changes in guidance in the way others might be. The other thing that's very important about those reminder signs is when we get outside, often we are outside and we are chatting and we are used to being outside from pre-COVID-19. And so we end up closer together or as we get deeper into conversation. And so reminder signs are a good way for people to be consciously reminded of the need to social distance. Equity training for parks and law enforcement staff to ensure that restrictions are equitably enforced can be incredibly helpful. And during the weekends where patronage increases, consider a system of access based on license plate or other factors that allow you to control access times. And the last recommendations are to consider closing, when we can't focus on parks, to consider closing streets to traffic in order to create safe open space for people to walk and bike, and to consider requesting non-essential workers sheltering from home to park in nearby parking lots so that there's more room on the streets for children to ride their bikes, etc. So thank you. I look forward to chatting with you more about other solutions in this moment.
Thank you, Melissa. Really appreciate that. And thank you for the very specific recommendations on how this delicate balance can happen. Thank you. With that, I'm going to move on to Annie Burke. Welcome, Annie. Annie is the Executive Director of Together Bay Area, a regional coalition working for lands, people, and communities. Previously known as the Bay Area Open Space Council, the organization was reformed in 2019 to address climate change and social inequities. Because of a new mission and values and refocused programs, the organization was renamed earlier this year and has been actively convening, connecting, and catalyzing action in the COVID-19 era. Annie, I'm really excited to hear what all these agencies are doing and thinking about to envision how we can be outdoors and physically distant at the same time. So thank you for joining us. Thank you.
Thank you for having me. And thank you, Dr. Razani, for your leadership during this time, well, and for many years before, in building the bridge between the parks world and the public health world. We really owe a lot to you and to UCSF for hosting us today. I also want to recognize that here in the Bay Area, we are in a lonely territory, and that I respectfully I respect the indigenous people of this area and that they're still here today and definitely a part of this conversation that we're having about equity and access. So I want to share some slides. So I'm going to talk a little bit about, I'm going to give you a tour really of what's happening around the region in terms of parks. In addressing some of the things that we've heard from today's speakers. We understand from Dr. Razani that you who are listening to this have questions about different park agencies making different decisions about closures, about some of the creative solutions to overcrowded parks and the need for public spaces, what's happening regionally, how do we communicate more clearly to the public about parks and what's going on, and also what's going on at a policy level. And how can we make some of these changes that we need to see? So those are some of the questions that I'm hoping that I can address in the next 10 minutes or so. Together Bay Area is a regional coalition for lands, people, and communities. We aren't a public agency. We don't own parks. We don't run programs with the public. What we do is bring together our 56 members who are public agencies, nonprofits, and indigenous tribes in the 9 counties, the Bay Area, and Santa Cruz, to work on some of the challenges that we're facing here in the 21st century, climate change and social inequities. And you could add a global health pandemic to that 21st century also, although that wasn't part of the original creation of this organization. It absolutely is what we're working on now. And we're really focused on a very inclusive set of things we want to work on and include all people and all lands. So natural and working lands. That means parks, but that also means farms and ranches. Urban and rural. That means city parks, pocket parks. It also means the big wide open spaces in the green belt surrounding the region. Together Bay Area runs 2 programs. The first is advocacy for transformational funding and policies, and the second is convening a powerful coalition. And I want to give a shout out to my political director and colleague, Shalana Da Silva, who leads that advocacy program along with a policy committee of our members. There's a bunch of things that I hope that I can convey, and I'm going to show you some slides and we're going to take a tour and see some parks, but there's a few things I want you to know. One is that there are around 100 park agencies in the Bay Area, and that includes cities, counties, open space districts, state parks, national parks, the Bureau of Land Management. There's like so many different kinds of agencies that are small, large, connected to other systems. Whether or not you know who runs your the park that you love, just know that there are a lot of different agencies that are doing this work, and that the authority to close parks lies with each of those separate agencies. There isn't one decision maker. There isn't one board of directors that makes a decision on these kinds of things. That authority is with each separate agency. Park agencies across the region are coordinating very closely with public health officers and public health departments. And if they weren't before March 2020, they certainly are now, and they're really doing a lot to learn the most recent information about public health orders and to accommodate what needs to happen in parks. People who work for park agencies do not want to close parks. They chose that profession, they went to graduate school, or they went through their training program, or whatever it is, in order to keep parks open. Right now, more than anything, it is so exciting that so many people want to go outside. It's like a dream come true for so many people that work in park agencies. And it's heartbreaking. I mean, really just devastating for people who work in park agencies to have to close parks. There were serious park equity problems, as Melissa talked about a few minutes ago, before COVID. Everything's being changed right now. Now we have the opportunity to address some of these things, and I hope that we can. Also want you to know that the public health, economic, and climate change crises are impacting everyone and everything. I'm sure everyone who's listening knows that because they feel it, they see it. But what it means is that we're rewriting the rules and developing new norms and creating the new future together right now. So if there's something that we want to change, if we want to increase collaboration, if we want to create more parks near where people live, now is the time to do that kind of work. So I want to give you some examples from around the region about public space design, about services that park agencies are providing, around regional and communications that's happening, coordination, and advocacy. Let's take a deep breath about that outdoor space first. There's a lot happening around the region around innovation of how we behave, how we move through public spaces. I'm only going to touch on some. This could be a whole research project. There could probably be a book about all the things that are happening right now to make parks more accessible in adapting to what our public health orders. So I'm just going to do some high-level examples. Some park agencies are opening up parking lots to people and closing them to cars in order to give space for walking. Golf courses are being converted, although I think that may be changing because golf courses are now essential and can be open, but reimagining what different open spaces are and how they're used. Slow streets are happening around the region. I personally would love to see more cities close streets to car traffic so that we have more outdoor space. So slow streets is for sure happening. 74 miles, I think, in the city of Oakland to close to cars in order to facilitate walking, biking, running, etc. And one-way trails are happening on some of our parks. And so I just want to show a few things. Santa Clara County Parks is making, they have a map to show where the wide trails are, and so that you can choose those trails. This is the San Mateo County Parks. As they're at the trailhead map showing how you can travel through this space in a safe way. This is an older photo. I don't think this is true anymore, but the golf course in the Presidio of San Francisco closed to golf and opened up to other uses. So there's a lot kind of how do we rethink our public spaces and our public parks that's happening. And there's a lot of critical and essential services that are happening right now too. I'm going to go through this pretty quickly. Park agencies take care of, are in charge of not just public access, but also natural resource management, taking care of our forests and our creeks and hillsides and making sure that we have habitat for wildlife. And so that's happening now, and we need to, they're working about how do we do this with all of the public health considerations. Here's some examples from Marin County Parks. Their staff, because they are county employees, are now being redeployed to the emergency, the EOC, Emergency Office, whatever EOC stands for. But they're also doing work still on park improvements. So there's still a lot of essential services that the park agencies are delivering in this moment. We're doing a lot around the region around public engagement and education. Over the past 2 months, we've been at Together Bay Area coordinating regional messaging and providing toolkits to our members and partners on how they can communicate more effectively, more positively, more inclusively with the public about what's happening and what is allowed and what's not allowed. Just this week, we launched BayAreaOutdoors.org, which is a regional website. So it doesn't get down to what can be done in Marin County versus Santa Clara County, but really trying to put parks forward as a positive solution to the challenges that we're facing. And I encourage you to go check that out. A lot of park agencies are talking about nearby nature and virtual nature. There's a lot of innovation happening around those two ideas. I want to talk about trailhead greeters, and I'll show you an example in just a second about that. Here's an example of the Bay Area Ridge Trail is taking BayAreaOutdoors.org and posted it to their social media feeds so that we can get the message out to as many people as we can. Here at the Together Bay Area website, you can see the regional toolkit that's available for anyone and our members and partners, anyone watching, to use to communicate clearly about what is possible and not possible in parks. Also, there's a video that you're welcome to use and share. Some park, here's some more examples. Here's the Napa Open Space District talking about how parks, face masks are encouraged. East Bay Regional Park District's done a really great job to create some content online. So their naturalists are providing these videos, kind of talks for kids. Some of them are, really targeted to very young kids, some to adults, to try to bring the parks home. And then Sonoma County Regional Parks is also talking about nearby nature Sonoma County and trying to kind of expand this idea of where parks are, much to Dr. Razani's point about nature, outdoors, and parks. Santa Clara Valley Open Space Authority has developed these talking points. I hope you can see them, the font's a little light, for their rangers and staff to use when welcoming new visitors to eat their preserves. And so they have a person who's welcoming people, talking about what they're asking park visitors to do and not do. And it's, from what I hear, going really well. Two more points and then I'll wrap up. One is that there's collaboration happening like never before. One of the great things about Zoom is that it doesn't take much to set up a Zoom meeting. What would have been a very hard meeting to schedule, and it would have taken months and a lot of driving and a lot of challenge, is now a Zoom call and happens with some regularity. Unfortunately, the pictures I have for this are not that great. It looks like any Zoom call. But I just want you all to know that the collaboration that there's a tremendous amount of collaboration happening across the region in lots of different cool and interesting ways that I think will have long-lasting effects. And then finally, I want to wrap up with the work that we're doing to advocate for funding and policies for parks. And not just parks, but open spaces, natural and working lands, urban and rural. We released a report last week, authored by my colleague Shalana, called Bay Area Lands, People and Economy. It was a report of the green stimulus opportunities, where we identified a very conservative estimate of the number of new jobs that we could create if we had the investment from the state to do them. And these jobs are on projects that are green, job sustaining, job creating, and that are ready to go. And so not only are parks and open spaces in the outdoors world important for our mental health, they also address some of those concerns that were talked about earlier, that people also need jobs and housing and some of those basic life components. So I want to bring that forward in this too. And with that, want to just wrap up by saying there's a lot of work happening right now. There's certainly a lot more that we could do. So I don't mean by any way that we are done or got it all handled or all figured out. Rather, I think this is this moment where we are figuring it out together, where we can bring together public health and the environmental field to figure out what the future is, and we can do that together. So again, thank you very much for having me, and thank you, Dr. Razani, for facilitating.
Thank you so much, Annie. Thank you. And I look forward to seeing you again in the question and answer period. So we've heard a lot of information about why we need parks and what parks are doing to address that need. We are going to move into the question and answer period, and I'd like to call all the panelists back to turn on their video. And I'd also like to introduce Dr. Rohan Radhakrishna, who is the co-chair of the Health Equity Committee of the California Conference of Local Health Officers, and he's also the Deputy Health Officer for Contra Costa County. Dr. Radhakrishna, are you here?
Present.
Welcome. Did you want to say a few words before we start answering questions?
Yes, before we hit the 3 o'clock hour and open up to more questions, I'd like to do 3 things briefly. First, review some key health equity points that have been brought up this far in the 3-part series. Second, talk about what local health departments are doing around health equity. And third, mention a few resources and a way forward. So if you think back to session 1, Dr. Bibbins Domingo from UC San Francisco told us that inequities are common, that they are large, and unfortunately they are persistent and pervasive. And she mentioned 3 main ways that this gets played out. For certain populations, they have a greater exposure, greater susceptibility, and poor access to health that can make COVID particularly devastating to those communities. So for exposure, that may mean based on their work or lifestyle, they have to commute more. Having less socioeconomic assets means less ability to telecommute perhaps, and more structural and social determinant of health challenges, increasing your exposure. I think we saw that in the Mission District study done in San Francisco with the Latinx community. Besides exposure, certain communities may face greater susceptibility. Those are the pre-existing chronic disease inequities. Melissa referred to the 10 to 17-year life expectancy gap beginning with, and that can include diabetes, heart disease, and lung disease, which can make COVID even worse on top of the existing inequities. So that's exposure and susceptibility. And finally, access, poor access due to insurance or perceived barriers to getting testing, to getting care. And we saw that in some of the early data from Los Angeles. So those are 3 reasons why we know that pre-existing inequities set us up for worse equities with COVID-19. What we heard from our panelists today and Katie was that.
Oh no. Dr. Radhakrishna, I think you've been muted. Well, Dr. Radhakrishna? Okay, well, until he comes back, I'm going to start some of our questions. And the first one, Katie Albright, I'm going to ask you. Officials have been citing increases in domestic violence association with this discussion about park access during the pandemic, but have been very vague about what that actually looks like in the real world. It's still unclear to me what's being implied here. First, is the increase in toxic stress causing abusers to escalate their abuse? Is it creating abuse where there previously was none? And the role of parks, is that the decrease in stress can decrease an abuser's likelihood of abusing or the frequency of their abuse? Or is it a refuge for victims of abuse to recover from that abuse? And I think that I can help answer that too. And Dr. Rohan, welcome back. We're just going to answer a question and then come back to you, okay? Okay, go ahead.
Great.
Katie Albright, if you want to take any of that.
Sure, absolutely. And I'm happy to answer the other question around what does toxic stress look like in adults as well. So let me start with domestic violence. Violence happens for a multiplicity of reasons. And the question is a complex one and the answer is also a complex one. So I'm gonna try to be succinct. But in many ways, violence can exist where there's isolation, where there's silence, where people don't have an outlet. I would say that there are two, let me just focus on two, but there are many factors around why domestic violence is increasing during this time. One is, what are the impacts on the survivor? The survivor has deep complexities of concern, particularly if the survivor is a parent or caregiver. How to keep their children safe during this time is a critical issue and concern. How to keep themselves safe. Often what would happen without COVID-19 or shelter in place is that you would go out into the community, develop a safety plan, perhaps with a provider or social worker or someone else who can help you, and you would get away from the perpetrator. We don't have that option right now. People are at home. They are fearing for their lives, health-wise, in terms of getting the pandemic and going out on the streets. They're fearing for their safety in terms of violence. But many people don't have food. They don't have a roof over their head. They don't have the independence. They don't have the ability to create a safety plan during this time. And often the choice for them, and it's individual choices, may be to stay at home. The other thing that's going on is that it is very stressful in homes, and that that people may be reacting in different ways, in more violent ways, and so that is also exacerbating abuse. Again, there is significant more risk factors, and abuse looks very different. Violence looks very different, from emotional violence to physical violence to sexual assault and sexual abuse. And so each one of those will have different reasons causing and exacerbating the concerns. What Parks does, particularly for domestic violence, and particularly for child abuse as well, is it allows people to go outside and get help, be with others, come out of isolation, create communities. I spoke about community protective factors and the importance of creating social connections. And that's what the Parks does, is allow us to be part of a greater community, potentially for a survivor to go out and get help, or in a family to lower the stress level for families, that so may not exacerbate the abuse that may be happening. To your other question around what toxic stress, or the chat's Q&A, what does toxic stress look like in adults? It relates very much to this issue. Normal stress is frankly what I'm feeling right now. The normal stress of presenting, your palms sweating, you're nervous, you're, sort of on site. Normal stress is good. It gets you and motivates you to the next level. It's toxic stress that is a concern. And it's when there's repeated impact on your fight, flight, or freeze response, and your immunology, an unscientific word, goes haywire. Your cortisol levels, your immunological systems are put at risk repeatedly. Dr. Nadine Burke Harris talks about seeing a bear in the woods, and you would run away if you were in the park in the woods, and that would be your stress level. But what happens when the bear is in your home? And that's what's going on right now. And so it changes your brain chemistry, your immunology, your genetics, your epigenetics, and that's where Parks can really come in and help.
And I think I could have also explained that those 4 things that I talked about: physical activity, access to fresh air, stress relief, and the opportunity for social interaction, actually help maintain your balance when you're dealing with toxic stress. And so what we've learned is that those really big stressors, abuse, can actually cause some changes in brain chemistry, which make you in a fight or flight state at all times. And when you have those other resiliency factors, I mean, it sounds simple, but just exercising, eating right, and sleeping can really mitigate the impact of those big adversities on brain development. And in an adult, the impact of stress when you are younger can look like poor health. So basically heart disease, obesity, all of those things increase with childhood adversity. And as an adult, if you're experiencing abuse, perhaps people can look at your website to look at what that looks like. And I think I think that it's an important question because people in parks may be stressed. And so it is important to think about how we interact with each other when we are in fight or flight states. And I think we all have a choice right now in whether we escalate situations or de-escalate them. And I'm going to move back to Dr. Rohan, but I'm just wondering, Katie Albright, from your experience, what is a trauma-informed way for park staff to interact with the general population, knowing that there's a very high level of stress?
It's a great question. And one of the pieces that I really want to emphasize is it's not just the park staff, and it's all of us. And I've been really sharing with everyone about the importance of three things: movement, mindfulness, and meaningful engagement during this time. And what park staff can do is the importance of compassion and just knowing that people may be struggling. So how do you approach folks in your parks in a compassionate, non-judgmental, healing, helping way? Just going up and asking how people are. Oftentimes is the piece that allows families to break a dynamic that may be happening, that may be an unhealthy dynamic going on, and offers an opportunity for people to reach out. And if you see people struggling, oftentimes we really recommend just go up and say, looks like you're having a hard time, can I help you? Without judgment. We all need help all the time. Thank you for that. Thank you. So Dr. Rohan, Radhakrishna, how are you? Welcome back.
Thank you. Thank you. And I think that's a perfect segue to the brief summary of today. Katie really talked about moving to asset protective frame. And when we think of infectious disease, the father of pathology, Rudolf Virchow, talked about pathogenesis. But now we're really talking about salutogenesis, and what are those protective aspects for families as well as the community. So the 3 M's as well as parks, movement, mindfulness, meaningful engagement, can be found in parks is something that as a family doctor, I prescribe to youth and adults to help handle these ACEs. I think we learned from your session that power of a single relationship, and even engaging a park staff that can model and share those 3 M's can really transform society. Students of epidemiology have heard the Whitehall study from the UK from Sir Michael Marmot that showed how socioeconomic variability almost has a dose response with morbidity and mortality. Well, you also shared the power of green space as an antidote to that. So I think we can see in the literature the protective aspects of green space to combat some of those inequities, and that's what we're here for. Melissa really shared that we need to take the whole person approach, and overcrowding, if that's a risk factor, then open space can be the protective factor for that. And I think some of the early transmission data from Wuhan showed the risk of overcrowding. So ensuring equitable access to open space is actually a public health intervention. We learned in session 1 from Dr. Rutherford that parks are safe. And I think today in session 3, we're hearing that parks are protective and part of our pandemic public health response. And finally, Annie told us that now is the time to rewrite norms and to collaborate like never before. So I can see that we're doing that and grateful for that. The second thing I wanted to share was what local health departments are doing. So at the state level, the California Department of Public Health does have an Office of Health Equity that has been championing this work and has actually applied for CDC funding to address a lot of these structural elements in a time of a pandemic to address particular communities. The California Conference of Local Health Officers has a committee dedicated to health equity, and I'm a co-chair along with Los Angeles's health director, Dr. Muntu Davis, and we have 3 priorities this year. That's housing, economic opportunity, and sustainable complete communities. That's really the interface that Annie's talking about for climate resiliency and social equity, really for active transportation and to prevent chronic disease. And so those are our legislative priorities, and we look forward to working with all of you for a broader coalition around supporting open space and complete streets and communities. And finally, some resources I wanted to mention where many of our partners are engaging in this, and I think the parks field could borrow and steal as we could from each other around messaging around equity. So in particular, besides BARHII, the Prevention Institute, Human Impact Partners, and the Public Health Alliance of Southern California have a lot of great guides around racial and social inequity messaging, and the Public Health Alliance of Southern California has a specific communications guideline around addressing discrimination and racism in COVID-19, and I think the park sector could borrow a lot in terms of social media, imaging, written communication to combat some of the xenophobia and discrimination that we're seeing. So in terms of the way forward, I'll leave us with this final phrase, which is we talk about intersectionality for all groups that may have been vulnerable or faced inequities coming together in union. And the counterpart to that is intersectorality. And I think public health and the park system and open spaces really will depend on each other more as we move into the future. We talk about the two C's of disease, chronic disease and communicable disease, and how they're related. And we've seen that historically, thanks to antibiotics and vaccines, fewer people die from communicable disease and more people are dying from chronic disease. But now we have this third C, which is climate-related disease and the impact of the environment and how they modulate each other. So I think that intersectorality between parks and public health will be essential to address all three: the communicable disease of coronavirus, the chronic disease that set the stage for the inequities that make the disproportionalities worse that we can see in the data right now, and climate disease, which is a public health emergency on a global scale. So I look forward to more intersectoral work to address this.
Dr. Radhakrishna, you can't leave us yet. So I know that you do lots of webinars for many different sectors. And so I'd love to hear your response to the concern that this question asks, that I hope you understand that park and park facilities have closed for the safety of park staff. Bathrooms, bathrooms can't be closed while allowing access because people will find other places in the park to relieve themselves. Cleaning open access bathrooms right now cause park staff to be exposed to undue risk. Closing the parks altogether keep park staff safe as well. Taking walks in your local neighborhood keeps everyone safe. What are your thoughts and how can we address the concerns of this person?
So there's a lot of equity issues built into that question. It includes who's cleaning the trash and cleaning bathrooms, and are we making all workers feel safe to support this type of cross-sector work? So I hope from the series so far in the 3 lecture series, park management as well as staff have learned tips, tricks, and resources to prevent transmission, to protect staff as well as the public in doing this work, to find low-risk ways to engage in healthy outdoor activity, and to work with your local health department to get the resources, guidelines, and trainings that you need. In fact, this whole series was born out of that very need for more of an evidence-based, data-driven approach to overcome fear, to help us all get outdoors and support the outdoors, including restrooms as well as trash. We know that park staff are frontline responders to the multiple epidemics of poverty and the lack of homes, and that you engage with human excrement, needles, a variety of challenges that put yourselves at risk, and we're grateful for all of that. So I think as first responders and essential workers that the health departments have clearly articulated parks as being essential, we want to support each other as responding to the needs of the public during this time.
Thank you. And does anyone else on the panel want to address that question? Otherwise, I'll move on. Melissa, thank you very much for your presentation. This is a question submitted in advance. Do you have specific examples of successful campaigns that integrated community into enforcement strategies? Envision for me how it could be done right, and how can enforcement of some of the public health ordinances be done in a way that is not discriminatory?
Okay, can you hear me?
Yes.
Okay, wonderful. So there are a number of strategies that we've seen, particularly in youth development and other youth serving programs, that really work with ambassadors, to have ambassadors in parks and in other types of community space, welcoming people, greeting people, having people feel comfortable and present, and then relationship building in a way that allows everyone to feel welcome in a space, and welcomed by people they recognize and understand as similar to themselves. And so that is something that we've seen be very effective in creating this sense of community that helps people abide by what the social norms are in that space. That's one strategy that we've seen and seen work quite well.
So actually having staff or docents who come from the communities that are being served by the parks, which I know is something that parks are working very hard on doing. And from what I've been reading about trauma, I also know that being welcoming is actually quite simple and even has to do with things like looking each other in the eye and being kind and taking time to pause. Do you have any simple tips on how to, well, I have two questions. One, we already addressed when people are very traumatized, how to be welcoming, but also when there is an intercultural exchange between someone in a park, whether it's a community member that feels like they need to police another person, or park staff, and they are speaking across culture. How can that be done in a way that doesn't escalate?
So the simple kindnesses, like you said, so eye contact, a smile, a clear statement, these kinds of things go a long way. And when people are stressed, they're sensitive to tone. They're sensitive to the way that how quickly people walk up to them. And so that kind of calmness is really, really helpful.
Thank you. Annie, thank you for sharing with us all the strategies. One person asked in advance, how will parks know that whether people are feeling excluded or not? What is the mechanism for community feedback? I know a lot of industries are struggling right now with the digital divide, and the fact that a lot of our interactions now are based on pre-existing relationships. And we are all collaborating by Zoom, which is really wonderful. But as Katie Albright talked about, the rates of abuse actually seemed like they were going down just because we weren't hearing from people for a while. And I've been hearing from school districts that they can't find some children at all. So what mechanisms do parks have in place to get feedback from community, or to integrate community into all these innovations and new policies that are happening?
A really good question, and I have two responses, but I'll just caveat them with there's always more that we could do, and that the social distancing orders that we have in place make some of these things harder. So, there's an answer for 2 months ago, and then there's today, and navigating how do you do town halls, how do you do public meetings, and they're by Zoom, and so, there's a lot of caveats to put on this, but two responses. One is that I hear from a lot of our members that they are inundated by public comment. People are reaching out and talking to park agencies about how parks should be closed, how parks should be open, why is this park this way and that park this way, and what about mountain bikes, and what about, my sense is that our park agencies feel overwhelmed, and I don't know how to measure that, but are getting a lot of input. And are hearing from the community members in a lot of different ways. They're hearing probably from the usual suspects, not from all community members, but they're hearing a lot. The second response is that in the Bay Area, particularly in the region I know well, is that there's a very tight-knit ecosystem of organizations that work together, both nonprofits and public agencies, who work together through programming and projects. And these nonprofits are often community-based organizations who are working closely with their community, and they have a partnership with their local park agency. And so there are those strong connections that create bridges in this moment from community needs to park agency leadership. One example is Yes, Nature to Neighborhoods in Richmond is an amazing organization that does good work to connect people to nature in Richmond, California. They have partnerships with East Bay Regional Park District and other park agencies. So there are some bridges. There's more that we could do, but there's definitely some different ways that what's happening in the community is getting, the information is getting into the park agency leadership.
And what I'm learning from today is maybe when people are seen in parks, maybe doing things that are seen as wrong or having trouble, those are actually the people that need help. And those may be the people to say, how are you? Are you okay? Because those might be the ones that are falling between the cracks.
I think that's right, that there's so much pressure, so much stress, and I think we have been socialized to behave differently in parks and open space than we do in more urban settings.
Right.
In urban settings, there are crosswalks and red lights and green lights and lines, and there's some structure, and then you go to Tilden or Golden Gate Park or somewhere, and there isn't that same structure. So I think there is some kind of letting the proverbial hair down, which could reveal some of these serious issues that are that look like bad behavior, but really are stress release or something else that some of your other panelists have talked about.
And I think you said to me once when we were talking that never before have so many people wanted to be outdoors. And I think those of us who don't work in park agencies really get it now, that access to nature is not a maybe, but a must have. I mean, when people talk to me about doing park prescriptions now, I'm like, why? Nobody needs to be convinced anymore. They just need a park. And so maybe with this huge need for parks, it might be time for parks to partner with Katie Albright's group and actually have social workers and resources to suicide prevention and other things available in parks. I'm just
absolutely. One of our mutual friends, Stacy Baer, who does a lot of work around mental health and the outdoors, talks about how we do have a national public health system. It's called the National Park System, and that we really should create that, much stronger. And you've been working, Dr. Razani, for years on this, healthy parks, healthy people. And maybe this is the moment where we really build a huge, very strong bridge between public health and public lands.
Thank you. And then a quick question for you, Annie. What is a slow street?
Good question. I didn't know that either until about a month ago. It's when a city or an agency decides to close a street to vehicular traffic in order to promote walking, biking, running. City of Oakland recently closed 74 miles of city streets in order to make it easier for their residents to just go outside and be active. And I know other cities are experimenting with it. I think sometimes I used to think of these as like Sunday streets, where city of San Francisco would close a street on a particular Sunday. But now it's happening much more broadly. And I learned recently that the city of Seattle is actually going to permanently close some of their currently temporarily closed streets because they see the value of letting people walk and just be in community with each other, not in their cars.
And I want to say, from a pediatric perspective, there's really no reason to be very idealistic about what nature means. And many communities that may seem nature deficient in terms of tree cover actually have amazing vitality and beauty and community. And so when streets are closed, there's a lot of joy that can happen. Right. I'm wondering, Dr. Radhakrishna and Melissa, if you have, in your work, seen any benefit to closing streets in terms of increasing access to the outdoors, and if you want to speak to that at all.
I'm here in Oakland, and I've really seen an incredible energy around the closed streets. And so more kids out on bikes, more people out chatting, and, keeping space. I've really seen people be able to abide by the social distancing orders and be able to talk to neighbors that they haven't seen in a while, that are also home. And so I think it's actually been a really nice community building experience, just in the way it is when we do National Night Out, and we close the streets for National Night Out, and members from across the neighborhood go outside, chat with each other, connect. It can be just a really powerful, positive experience that helps people decompress a little with the challenges that we're all experiencing right now.
And Melissa or Katie, do either of you know of de-escalation classes that people can participate in?
It's a good question. I'd love to be able to share, Dr. Razani, some additional information, but at a high level, there is a fantastic collaboration through San Francisco's Department of Public Health called Trauma-Informed Systems. And it really underscores what this question really alludes to, is what are the inequities that we are facing, and who are we putting on the front lines in terms of how do you create access in our communities, and how do you create access in our communities when the people that are at the front line are maybe in a vulnerable circumstance, or maybe in a marginalized community themselves, and what are the inequities associated with that? So I'm very happy to share resources around de-escalation, but also within this overall scope that we all have to figure out and have a role to play in this process, and creating not just trauma-informed practices, but how do we create a trauma-informed system so that we are supporting everyone at every level, from leadership to all parts of the organization, focusing on Department of Public Health to parks, to schools, to everything that intersects and comes together. And so highly recommend training from the Department of Public Health. It's about a 4-hour training online, and it's a fantastic one. And in it has some tips around de-escalation, and I can provide some of that information.
Thank you. And I also see a correction that slow streets are not always necessarily fully closed to vehicular traffic. But we have 4 minutes left, and I want to ask you each my final question. So it's 2025. We're all healthy, thriving, and thinking back to 2020. What did we do right? Give me 2 things that we did right so that everyone, all of us, our whole community, had a chance to be outside in nature and heal, and the people working in parks felt safe and prepared to deal with the surge. Why don't we start with Annie? 2 things we did right in 2020.
The first is that we've adequately funded parks and open space and natural resource management, so that the agencies, the organizations that work in this field have the financial resources as well as the training and everything to do what they're being called to do in this moment, and will be in the future. So adequate funding for these essential services. 2 is, I'm going to piggyback off of Dr. Rohan's intersectorality. Did I say that right? Is that we really start breaking down or working across different sectors, and that we see each other as part of a symphony, playing different instruments, doing different things, but we can't all be drums and we can't all be trumpets. We really need to work in unison so that we can address some of these big issues. I mean, we're all talking about institutional racism and how it shows up in parks and families and health and economic. I mean, so we really need to work together on some of these underlying issues that are facing our country and our region.
Thank you, Annie. Mm-hmm. Dr. Rohan.
2 things. would be to shine a light and share our skills. So shining a light means doing the painful introspective work of identifying inequities within our systems, within our structures, within our workplaces. That includes within healthcare, public health, and within the park system, looking at power dynamics, looking at the narratives that we share, who's constructing them, how they're communicated, what level of inclusivity is happening, and what are the disproportionalities in terms of our own workforce. Are our leaders, the boards, the directors representative of the people that we're serving, both in terms of what people look like and talk like, race, ethnicity, language, sexual orientation, gender identity. We've been starting to do this work with implicit bias training, microaggression training, thanks to BARHII in the health sphere. And I think we just need to keep doing it. The New York Times Sunday magazine last week was titled "Who Lives, Who Dies?" And this, as was mentioned, is really pulling the curtain back on inequity in our society. And I think we need to not shy away from that, but lean into that, to be honest about what's happened and what's happening. And the second part of shining a light is to share our skills. That's part of that. We're all in this together. As a health provider, I need to be a steward of open space. As a steward of open space, you may need to learn about adverse childhood experiences and de-escalation and nonviolent communication. And I think as much as we can share knowledge, science, data, including the social psychology of engagement and inclusivity, the better poised we'll be to do this work across sectors for the long term.
Thank you. Thank you, Dr. Rohan. Katie Albright.
Well, echoing others, I would say that we look at this as opportunity for change and we not return to the status quo. And in that, I wanted to read a quotation that one of my colleagues shared with me recently. It's by Sonia Renee Taylor. And it says, "We will not go back to normal. Normal never was. Our pre-corona existence is not normal, other than we normalize greed, inequity, exhaustion, depletion, extraction, disconnection, confusion, rage, hoarding, hate, and lack. We should not long to return, my friends. We are being given an opportunity to stitch a new garment, one that fits all of us for humanity and for nature."
Thank you. And Melissa Jones.
Yes, so we'll have done two things. We'll have made a housing system that works so that people are not paying so much of their income for housing. They're not choosing between food and medical care and having a roof over their head. And we'll have solved our issues around living wage. And the combination of solving the high cost of housing and solving the issues around living wage means people have time to get out to the parks. They have time for family. They have time, they're not spending all of their time at work to make ends meet. And so right now we're in a moment where a lot of people are out of work. So they're home and able to get to the parks with their families in a way that they haven't been able to in quite a long time. And the way that that continues to be something that people can do in a way that they can enjoy themselves, have fun as a family, diffuse energy, is that they are able to afford to have free time. And it's a luxury that so many of us don't have on a usual basis.
Well, thank you really each. And thank you to the many, many people who have joined these 3 lecture series. What I've really gotten out of this is really understanding how much we all have in common. There is so much binding us together all across the world at this time. And I feel excited to get to 2025. And now that we have a roadmap, thank you each. There are multiple requests for the links to the last 2 lectures, and they're both here. Here is also our website for upcoming events and information, and then also a big thank you to the many organizations that helped put this series together. And I hope we all have a chance to convene outdoors one day. Thank you each.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank you.